So what are the treatments for dry eye? Essentially, this can be an hour, 2 hour long lecture. In fact, there are conferences specifically for dry eye treatments. It is that broad of a topic. But to break it down, to make it simple, what are the treatments that we have? So we'll break it into over-the-counter and prescription. Prescription obviously only given to you by an eye doctor, and we'll touch on that a little bit in the end. But mainly it's the over-the-counter treatments. Just like your skin needs, hand moisturizer or anything like that, your eyes are no different. Okay? In fact, even people that don't have dry eyes, I recommend they use tears, artificial tears, same way you should moisturize your hands. It's always good to have healthy eyes. It's definitely going to help you in the future. So even if you feel like you don't have dry eyes, putting a drop or two in a day will do a lot in the long run. So number one is just your over-the-counter artificial teardrop. Okay, there are tons of brands out there. You go to the store, there's a whole aisle just full of these things. Look at my earlier video about how pharmaceutical companies like to take advantage of marketing tactics to get you to essentially pay more for the same drops. But anyway, you have them there. A lot of eye doctors say, go try them, see which works best for you. I don't agree with that. One, that takes a long time now that there's 40 different options. And two, if you just look at the clinical and the evidence-based medicine, look at the research, all the studies that were done, there are certain drops that are better for some people and not. So, for a quick breakdown. If you just have some mild dry eye, or you're just using tears preventatively, just your regular over-the-counter eye drop is great. It changes from time to time, but as long as it says artificial tear on it, okay, that's the one you want to go for. Right? Not Visine, not Clear Eyes. It has to say artificial tears on it. Right? Visine and Clear Eyes are just terrible for your eye. You should never use those. If you have them, pause this video, go throw them away. You're doing your eyes a huge favor. The second class, just step up from your regular artificial tears, is your preservative-free artificial tears. Now these are the exact same things that the other basic ones have, but they've removed all the preservatives from them. Okay, so they come in single-use vials. You can only, when you open it, you can only use it for that day, then you gotta throw it away. There's no preservatives. Whereas the bottles, they last for a long time because of the preservatives. We recommend these for anyone that has moderate dry eye disease and above. The reason why is the preservatives in some of the basic drops can actually cause irritation to your eye. So if you have a very dry eye, your eyes aren't getting moisturized enough, and you put the preservatives on there, you can create some irritation, and that in effect will actually worsen your dry eye. So preservative-free tears are very important for anyone with moderate, severe, and above, because it removes that preservatives in there and helps prevent that irritation. Again, like the other drops, a ton of brands out there, they all claim something different. They're all essentially the same, okay? They just have to say preservative-free, and that's the main point. They're gonna try to sell you on, they have this and there, it's digital, it's long-lasting. No, these drops are all the same as was seen in my previous video. After that, you come to the end of pretty much the over-the-counter drops that are available, but then there's still a lot of other things. You have your lid scrubs, foams, lid scrubs, things like that. These are essential for those meibomian glands, the oily layer of your tear, which we talked about in our What is Dry Eye video. And what they do is they clean your eyelids and the eyelid margin, okay? And that allows the meibomian glands to express their material better, which would create a better oily layer of your tears. Some people add warm compresses to this because the heat also helps express the glands. So for example, someone who has severe dry eye disease, if they're just in the over-the-counter stage, should be using preservative-free artificial tears 4 times a day, in addition to the lid scrubs before bed and hot compresses. Okay, that you're addressing the watery layer and the oily layer and also the mucus layers with those two treatments, and then you start to get to healthy eyes. Okay, and these are no different than any other medicine. You have to keep using them every day. Okay, you can't just use them for a couple of days, your eye feels better, and then stop because it's just going to come back. This is an everyday thing, just like we put moisturizer on our faces every day, hands. So then you come to the supplements and other things that you see in the supermarkets. Really, the only one that is worth mentioning is the omega-3, the fish oils. There have been studies that show their efficacy and that they work, especially for patients with meibomian gland disease. And so I do recommend those for any patient that has the meibomian gland disease and severe dry eye. Someone who has moderate and mild doesn't need these. Okay, so if you just have some mild dry eye and your meibomian glands are fine, you have someone telling you got to use compresses, this, that, it's not true. You know, they're just trying to sell some product. But I do recommend the omega-3s and the supplements for patients with severe dry eye. After this, if none of those are working, then you start going to the prescription. And you go to your dry eye specialist, whether that's an optometrist or an ophthalmologist, and they will do their tests. And now we have all sorts of great tests that they can do on your glands and your eyes and find the appropriate prescription medicine. But just for reference, Restasis, Xiidra, Sequa, okay, they just approved the nasal spray for a prescription nasal spray for the treatment of dry eye. So these are prescription, they need to work with your doctor. And then you have procedures as well that they can do. Plugs that they can put in your lacrimal glands and in your tear ducts, I mean. So all those need to be talked with your specialist. In the next video, I will actually talk about the scams that I call them that are out there that you should avoid, as there are a lot of them. So look at that video, but for the purposes of this one, those over-the-counter teardrops and the lid scrubs, lid hygiene, that's the majority. Okay, that's the mainstay. And then if needed, you go to the prescription. I would be wary of any doctor that just tells you to immediately start prescription drops for your dry eye without starting the over-the-counter, because that is not the standard of care, and studies show that is not necessary.